Hello, hello, hello. A very good evening to all of you. Welcome to another session on Ask Me Anything related to breastfeeding your baby. My name is Dr. Tanema Singhal, and with full love and blessings, I welcome you all. And first of all, wish you all a very, very happy International Women's Day. Each and every woman is a strong warrior, and being a mother adds to that armor. So all of you just be very strong. I know you might be going through different phases. This phase of new motherhood it seems challenging, but don't worry. As a mother and as a doctor, I can just assure you it will pass on. Just flow with the flow right now, and you will see that you will start shining in very beautiful colors, and you will come out in flying colors. So on this note, let's start our session. So first I'll take the questions which you have filled in the Google form, and then I'll take the live questions. So there are less questions this time. So first let me answer those. So first question is from Shelly. Why breastfeeding causes nipple pain? So Shelly, breastfeeding doesn't cause nipple pain. It is basically the shallow latching which may cause nipple pain. So what will happen if the baby is feeding only on the nipple? That will cause you pain. Otherwise, if you have a deep latch with a proper asymmetrical deep latch, it will not cause you any kind of pain. So if you are having issues related to nipple pain, then get your latch resolved. So we have a dedicated latching expert in our team. You can contact her if you are having only latching issues. But if your milk supply is less and you want to work on both latching and milk production, then you need to contact our team of doctors. Next question is from Iman. Ma'am, my milk production is same as before, even though I am following the protocols given by the doctor. And only one thing is that I pump only once a night. Is your treatment same as your trained doctors or different? So first of all, Iman, because I have trained them, so the treatment protocols are different. I'm saying it is just same, basically because I have trained them. But obviously, with experience, you can counsel the mothers better. That is one thing which what I can say. But otherwise, the protocols are the same. And I was just going through your assessment form and other things because I read this question in the afternoon. So I have seen, Iman, that you're not able to follow the protocols in the way that because you are alone at your home and you have a lot of works at your home, you're not able to give full time. You're following the medicine protocols, but the things given to you to do, like latching the baby frequently and also by giving the pumping protocols, you're not able to follow in one. So right now, what I would suggest, trust in the doctor. The things they have told you, just continue with that. Also, I see that your formula milk has not increased. So that is one good point. As the baby is growing, so baby's formula should increase, but it is not increasing. That is a very good sign. Just follow the protocols properly along with whatever things they are advising you. Your milk supply will definitely improve and your formula milk will come down and you will be coming out in exclusive breastfeeding. So just don't worry, Iman. Just trust a doctor and keep moving. Next question is from Divya Koti. Sometimes nipples go soft or flat. How to make it easy for latching? So that is by a correct hold. So first of all, if you feel that the nipples become very soft or flat, first of all, don't worry. How you need to hold the baby and how to hold the breast. Many times you mothers are holding in scissor shape. So that will block the areola and the baby will not be able to have a bigger bite of breast. So in that case, what you need to do, if you are feeding from the left breast, then hold the breast in U shape from below and then press the breast so that a pout of areola and nipple is formed and baby will be able to latch on the areola. So this way it will become easy for the latch, and even if you have a soft breast or a flat nipple, still it will not cause any problem in latching. Next question is from Ankita Shastri. Namaste, ma'am. Under treatment and now my baby is 15 weeks old. He's not coming on the breast. Now what? I won't be able to keep pumping for long. Feeling very disappointed and failed. So first of all, Ankita, don't worry. I have seen your video today. Dr. Bini discussed with me today. And I have seen the way you are holding baby is not correct. You are just putting the baby like this. And what I remember, yes, you are trying like this. So that is not the correct. She has shared the videos with you. Please watch the videos and follow the proper techniques and the trips. And your baby is crying at that time when you're trying. When the baby is very cranky or his baby is not comfortable, the baby will not cooperate. You will feel more depressed at that time. So please follow the videos properly, and don't worry with all the mothers when the issues are not getting resolved. The doctors talk to me, they discuss the cases with me, and I tell them what we need to do in that. So today, Ankita, we have watched your video because I think you sent it in the afternoon or evening today itself. So we watched it, Ankita, and just follow the proper techniques for latching your baby. You are not following the proper latching techniques. So just follow that and it will be all okay. Don't worry, Ankita. So these were the questions there. Now let me take the live questions. Just a minute. Yeah. So first question is from Drisha Payani. At times, my kid latches for a good 23 to 30 minutes, but now he leaves in 15. He finished 2 months. Can you please guide? So first of all, Drisha, you don't need to worry if your baby's feeding time has decreased. You just see your baby's weight gain. So your baby is 2 months old now. So if the baby is gaining 200 grams per week, and the baby's formula milk is either not there or not increasing, in fact, it is decreasing, then you are on the correct path. The milk supply starts regulating. If you are doing it regularly, the demand and supply chain, if you are regularly maintaining, the milk supply will regulate. The baby will have good milk in less time itself. And obviously, the baby is growing, so the baby's latch will become more strong and powerful. So, Trisha, just check the baby's weight. If the baby is gaining 200 grams per week, you are good to go. Don't worry about the less time of the baby on the breast. Ramya says, Happy Women's Day, ma'am. Thank you so much, Ramya, and a very happy Women's Day to you too. The audio is not clear. Please give me a hands up if my audio is clear. If my audio is clear, please give me a hands up, because according to me, the video is all fine. You can just raise your hand, or anyhow, you can just let me know. Is my audio clear? My audio is not clear? Yeah, it is clear. Thank you so much. So I think there would be some difficulty with your name is not written, anonymous attendee it is written. So please check your internet connection, because from my side I am using a proper Wi-Fi and following proper technical things to maintain the audio. Next question is from Umaya. My baby is 3.5 months. Past few days she is not feed at wake time. She only feeds at sleep with proper latch. During wake, when I try to latch, she cries aloud. Yes, Umaya, it happens because she's 3.5 months and she's distracted. She wants to play. Previously, when the baby was small, the baby was able to feed more. The baby would frequently feed. But now the baby has to play. So what will happen? They will be distracted a lot. So in that case, what you need to do, just try to see that you remove all the distractions. So what we mean by distractions, if you can just lower the light of your room, just dim the light of your room. Second thing is, don't have any toys around the child when you're trying to feed the baby. Third, if they like you during feeding after 3 months, baby starts blabbering. They just like, they start making some noises. Just don't respond at that time, because if you respond, if you smile, they feel that you are talking to them or you are giving attention. Babies are attention seekers. So if you give attention at that time, they will leave the breast or will not feed properly, or will just smile when you are there feeding. So all these things will happen. So just make sure that you have a quiet feeding time for your child. Also, it should not be like when the baby becomes too hungry, then only you are trying, because babies at this time have a very short span of attention. So you need to just feed them properly, and when you are feeding them, just try to like focus on them. Don't try to talk on phone or talk to anybody, because babies need full attention. But just don't respond to their blabbering or their cooing, so that they can feed properly. And also mind one thing, once you finish the breastfeeding, just don't push away the baby. That feeding is done, go away, my work is done. No, just spend some 5-10 minutes cuddling with your child, just playing with your child. So the baby knows after feeding, my mother will spend time with me. So just follow these tips and tricks and it will be all okay, Umaya. Next question is from Ravali Vemula. Hi, I have a low milk supply and I started formula. I want to give my milk only to my baby. How can I fix it? So Ruvali, I am going to tell you a few things. You need to follow that. But I am always giving a disclaimer, follow for 1 week only. If you are not seeing any results in 1 week, then there is no use of wasting time there. Just reach out to the team and get your issues resolved directly from our doctors. So the few things which you can work for increasing your milk supplies, first of all, improving the demand. So if your baby is coming on the breast, just try to feed the baby on every breastfeeding. Whenever the baby is demanding for milk, first try for direct breastfeeding only. And if your child is not coming on the breast, then you have to create the demand with pumping. So in both the ways, you need to create a proper demand as per your baby's demand to your brain, so that the brain understands the demand and starts making milk supply. Along with that, you need to maintain proper hydration. Second thing is you need to do oil massage and warm compress on the breast to improve the flow of the milk. Third, you need to take some supplements like lactomagic powder and Morico tablets, which I recommend to the mothers, and our doctors are also recommending that. So you need to follow that. Fourth thing, lot of cuddling and skin to skin with your child. And fifth is the weight gain. So you need to check the weight day 1 and day 7. If your baby is gaining weight, if less than 3 months, baby should gain 200 grams. If baby is between 3 to 5 months, the baby should gain around 100 to 150 grams. And more than 5 months, baby should gain 100 grams. After 6 months, solids are introduced, so we don't focus a lot on weight gain. So this way you have to check the baby's weight. If the baby is gaining weight and the formula milk is not increasing and decreasing, you're on the correct path. But 1 week is done and you are not seeing any results, then there is no time in wasting by yourself. Just reach out to the team and get your issues resolved by having an appointment set up with our team of doctors. Next question is from Umaya. And always sucking fingers and fist of hand instead of crying during hungry time, ma'am. So first of all, Umaya, don't worry that sucking fingers or fist of hand is a sign of hunger. Not necessary. Babies do self-exploration also. The self-exploration of their body is usually by sucking their hands or by sucking their fingers. So that is not an indication that they are very hungry. So she's also saying, Umaya, I tried bottle feed too. She's not sucking bottle, ma'am. I'm happy that my baby is not sucking the bottle. I always love the babies who are rejecting the bottle, because that way the mother will be on the edge. What I need to do to get my child on the breast? So Umaya, you first check the baby's weight. Your baby is 3.5 months old, so baby should gain around 150 grams in a week. If your baby is gaining 150 grams in a week, then don't worry, Umaya, it's fine. The milk supply starts regulating for some mothers. And if the baby is getting enough, the baby will obviously have weight gain. So don't worry about it. Next question is from Anshu. My baby is 3.5 months old. She is not demanding for feed herself, and she is not gaining weight from last 1 month. Her birth weight was 2.6 kg and her weight from last 1 month is 5.3 kg. So 3.5 months, so you would have checked the weight at 2.5 months. So at around 2 months, we need 8. It is 1.6, 612, 5.2. So actually her weight was okay at 2.5 months as 5.2 or 5.3. But if it has not increased in last 1 month, then it is a concern, because now the baby should have become around 5.9 to 6 kgs. So what you need to do, Anshu, you need to give more hind milk to your child. As you said that she is not demanding for feed herself. So that means you need to do it frequent feeding by yourself till the baby starts gaining properly. And if she is not drinking properly, you need to express the hind milk and give it to your child. So in any case, if you are facing these kind of issues and you have tried everything and it is not working in your favor, then there is no use of wasting time there. Just reach out to the team tomorrow and get your appointment set up as soon as possible, because weight gain is important. If I talk about 2.5 months, 5.2 kg was okay, but her birth weight was also very less. It was just 2.6 kg. So we have to work on the weight also. So keeping the birth weight in mind, 5.2 kg at 2.5 months was okay. But since 1 month baby has not gained, this is a big concern. And since her birth weight was less, so we need to work fast on that so that we can increase the weight fast. So all these things can be resolved by giving more hind milk to the child, by feeding properly, by feeding frequently, and tracking the weight gain every week. So this is easily achievable, Anshu. Please reach out to the team and get your appointment set up from them. Next question is from Ankita. I tried, ma'am, but he cries only the moment I hold him to try. Even when he is happy playing, I try and he starts crying. Okay, if this is happening, then this is a very visible case of breast aversion. So what I see, what I advise you, Ankita, for few days, like 3-4 days, just give a gap to your child. Just hold the baby skin to skin with you. Don't try for breastfeeding because he's now understanding that you are going to try. And that's why he's becoming very fussy. So for few days, just don't try for breastfeeding. Just hold him close to you, to your chest. Just have his trust back, so that my mama is keeping me to the chest, not putting me on the breast. So just try for few days, keeping him skin to skin, have a good bond with your child. And during when he's playing, when he's cuddling, that time you just lie down with him and slowly open the chest and let the baby explore the breast by tickling, or sometimes the baby will come on the breast and then will leave. That's okay. But do this after 3 to 4 days when you have just kept the baby skin to skin only for yourself. Next question is from Gausalya Velusamy. Good evening, ma'am. Nipple part and most of the areola part is inside on the mouth only, but also my breast is so paining and burning. Okay, so first of all, in the first part, when you said that areola, full part, you don't have to put full areola in the baby's mouth. Only the lower part of the areola should be in the baby's mouth. So how you can ensure that? Once you have latched the baby, just make sure that the baby's head is extended. So that way the nipple will be pointing towards the upper palate, not in the middle of the mouth. So this will make the latch comfortable for you. Second thing, as you said, it is paining and burning. This is different. So now, first of all, we have to understand that is it a pain or is it a burning? So there is something called as let down pain, which is caused by a hormone called as oxytocin. What happens that is a threshold of pain. Some mothers might feel that there is a tingling sensation, there is a kind of needles are pricking on the breast, or a burning kind of a pain. And if you are feeling this on the whole breast, then that is because of the oxytocin hormone. If you are feeling the pain only on the nipple and nipple around the nipple, that is because of the latching pain. So in your case, what I am understanding, it is the whole breast which is paining, and it is a burning kind of a feeling and needle pricking. So this is basically because of oxytocin hormone. So what you need to do, once you have breastfed the child, just put cold compress on the breast. After you have fed, just put cold compress, then there will be numbness and it will help you resolve the issue. It's okay, your baby would be less than 6 weeks, I suppose. So this is more common for babies who are like 1 month or less. But once the baby starts growing, you will start seeing that this pain will go away. So just write in the chat box, is your baby less than 6 weeks? So that I can understand that. And also let me know whether this is the whole breast pain or only in the nipple part. So that way I will be able to understand it is a hormonal pain or it is due to latching. Umaya says, thank you. You're most welcome, dear. Next question is from Umaya again. I have also low milk supply. Please suggest medicine. I just told right now about it. Just watch the recording if you have missed that, and work for a few days and see, work for 1 week. If you're not seeing any results, get to the doctors and get your issues resolved. Next question is from Ravali Vimala. Yes, doctor, I'm trying to give her on demand and she's also coming to the breast, but she's crying when latching as she does not getting milk. But still I'm giving around 45 minutes after that also she's crying. And then I'm hopelessly giving formula to her. So 45 minutes of feeding if you are doing, that means that is a shallow latch. And that is also a passive latch. It is not an active feeding. If you are seeing the gulping movement in the neck, that means it is an active feeding. If you are just seeing the mouth movements, it is not an active feeding. So Ravali, you need to see when you are latching the baby, is the baby doing gulping movements or not? If gulping movements are not there, the baby is not drinking milk. The baby is just putting her mouth, just moving the mouth. So all these things you need to understand. And if your milk supply is less and you're not getting enough milk for your child, then just reach out to the team and get your issues resolved here. Because I understand if you just keep trying on tips and tricks, it will take a lot of time. and we don't have much time for breastfeeding. By the time the mother realizes that there is some problem, there is already 1.5 months is this gone. So now if you try for tips and tricks, it will take more time. So if you have tried everything and nothing is helping you right now, then there is no time and there is no use of wasting time. Just reach out to the team. So Ankita says, last time also felt this and gave a gap of 7 days. He was getting comfortable, and as soon as I started to follow, try direct feeding, every time he starts getting irritated again. Oh, so that is how old is Ankita? How old is your baby? Just write once. I am not remembering. I think just write. I just don't remember. Just write, Ankita. How old is your baby? Next question is from Umaya. Birth weight 2.4. Now at 3.5 months, she's 5 kgs. Is it normal? So 2.4 and now 3.5 months. So till 3 months, 2.4 to 8, 4.8, and then 300 more. So 4.8, it should be 5.1. You know? So 5.1. So it is 5 kgs. It is fine. It's okay. So 5.1 we needed. It is 5 kgs. 100, 200 grams, you can cover it up. But 2.4 kg was a less birth weight. So we need to work on improving her weight more, because 2.4 kg as a birth weight was on a lesser side. So you said, I'm also using pumping. I can collect only 30 ml for 3 hours. Is it enough? Or I don't know whether I have low milk. Please suggest me for how many hours gap can I pump of milk when she rejects milk. So you can, obviously you're doing correct at 3.5 months, 3 hourly pump is fine. And what I see here, the weight gain has been fine, but I would like to have more weight for the child, because her birth weight was less. So I would like that she should have more weight gain now, although as per the parameters, her weight gain is fine. But because her birth weight itself was less, so if we can improve her weight right now to have good buffer when she had start solids, because that time the babies lose weight. So if we will have a good buffer right now, it will be best for your child. So if your milk supply is all well, Umaya, and just few things, then you can just follow Lactomagic and Moriko and a few things which I suggested, and you can work on it. But if you feel that you need some extra help into that, then you can reach out to the team. Next is Gauselia. It is only on the nipple, ma'am, and my baby is 3 weeks old. So if you're having nipple pain, then that is a latching pain usually. And 3 weeks old. So as I said that usually up to 6 weeks you feel that issue. It is more common there. Just apply cold compress after the feeding and see. But if it is only on the nipple, I doubt it, because nipple pain is basically due to latching. So as you said that you are giving full areola in the baby's mouth, just see you give mostly on the lower part of areola. What I suggest, Gosela, you just have a call with the latching expert. She will guide you on one-on-one, having a direct video call with you to about the latching. That way your issue will get resolved properly. So just reach out to the team tomorrow. Only that lower part of areola shall I insert on the baby mouth? Yes, only lower part, not the full areola. Because if you put full areola in the baby's mouth will be stuffed and the baby will try to suck harder, and that will cause you pain. And also make sure that the nipple should be pointing towards the upper palate, not in the middle of the mouth. So all these things you need to watch it. Ankita says 15 weeks. Oh, 15 weeks is nearly 3.5 months. So 3.5 months, baby is not coming on the breast and causing a lot of issues with the latching. What can be done, Ankita? You've already tried everything. You have given gap to the baby. But what is here, Ankita? The latching video which you have sent today is not the kind of latching which we want. The way you are holding the baby. Just unmute. Do you want to unmute, Ankita? Would you like to have a talk with me? I've allowed you to talk if you want to have a talk with me.
हेलो मैम,
Yes,
नमस्ते मैम। क्या हो रहा है कि आप जो कह रही हैं ना कि जो हमने वीडियो भेजा है वैसे ट्राई कीजिए। मैं वैसे भी करके देख चुकी हूँ उसको प्रॉपर सिचुएशन में लेके। तो मैंने बताया था कि ऐसे करने से भी वो रोता है। तो फिर आप ही से बात हुई थी वेबिनार में ही, तो आपने कहा था कि अभी जैसे भी पोजीशन में है, अगर वो पकड़ लेता है तो अच्छी बात है, पकड़ना भी जरूरी है। तो फिर मैं जैसे भी होता है सब तरीके से ट्राई करती हूँ, प्रॉपर पोजीशन जैसा वीडियो में दिखाया वैसा करके भी, ऐसे करके भी। और क्योंकि मेरे पास वीडियो बनाने के लिए जनरली कोई रहता नहीं है, तो कल सिस्टर अवेलेबल थी उस टाइम पर, तो मैंने उसको बोला कि अभी आप बना दीजिए वीडियो, तो उन्होंने बनाया। तो वो उस वक्त में फिर मैं लगी, मैं मैम को बोला था कि वो रोता बहुत है, तो क्या मैं रोता हुआ ही वीडियो बना दूं, क्योंकि लैश तो वो कर ही नहीं रहा है। तो मैम ने बोला था कि ठीक है, जैसा भी है अभी वैसा ही वीडियो आप बना के भेज दीजिए। तो मैंने
ओके,
फिर वैसा ही वीडियो उसको बना के भेज दिया था।
ठीक है अंकिता, देखो मैं कुछ कुछ पॉइंट्स बता रही हूँ, तो इन चीजों पे आज थोड़ा ध्यान दे करके तब ट्राई करना जब थोड़ा मूड उसका ठीक हो। सबसे पहले तो सीधा बैठना, और जो तुमने पिलो जैसे लिया हुआ है, तुम्हारा पिलो बहुत नीचा है, करीब 2 या 3 पिलो रखना कि बच्चे का पूरा एकदम तुम्हारे बराबर, जैसे बच्चा तुम्हारा यहाँ तक आ जाए। ठीक है,
हम्म। हम्म।
जो तुम देख नहीं रही हो इसलिए मुझे पता नहीं तुम तो हाँ कर रही हो या नहीं,
हाँ हाँ,
क्योंकि तो
हाँ मैं
कौन
देख रही हूँ।
वीडियो।
हाँ
ठीक
मैं
है,
बोल
तो
दूंगी उससे।
बच्चे को अपनी तरफ ऐसे घुमा के रखो, और अभी ब्रेस्ट नहीं खोलना, क्योंकि
हाँ
जैसे ही खोलोगे वो समझ जाएगा। ठीक है,
हाँ।
बस बच्चे को अपनी तरफ रखना, और ऐसा कुछ ड्रेस पहनना जो कि तुम फौरन खोल सको उस समय।
हम्म।
ठीक है,
हम्म। हम्म।
अब उसको अपनी तरफ रखो, थोड़ा खिलाओ, ये नहीं कि फौरन ड्रेस पे चले जाओ, उसके अंदर
हाँ
थोड़ा
हाँ।
खेलो उसके साथ, थोड़ा वो करो। एंड उसको जैसे अपने पास थोड़ा लय करके आओ, तो वो थोड़ा खींचेगा अपने आप को, थोड़ा थोड़ा ऐसे ऐसे करेगा उसके अंदर,
हाँ
विच इज फाइन।
हाँ।
ठीक है, अब जब थोड़ा सेटल हो जाए, तब धीरे से हल्का सा ब्रेस्ट ओपन करो, और बस थोड़ा सा आगे बढ़ो उसके अंदर।
हाँ
ठीक है, बिल्कुल फोर्स नहीं करना उसको।
हाँ।
ठीक है,
हाँ
तो अभी वो हेड को पीछे करेगा, बिल्कुल आई
हाँ।
अंडरस्टैंड, वो ऐसे ऐसे पीछे हेड करेगा। फाइन, अब तुम ये वाला हाथ धीरे से उसके पीछे ले आओ। ठीक है,
हाँ
अभी
हाँ।
मतलब बहुत ध्यान से करना है, बच्चा तुम्हारा बहुत समझदार है इसका मतलब, तो उसके
बहुत
साथ
ज्यादा।
थोड़ा हमको भी ट्रिक के साथ करना है। तो धीरे से हाथ पीछे ले आई। ठीक है, अब
हम्म।
हल्के से हाथ से धीरे से ब्रेस्ट ओपन किया, और हल्का सा ऐसा ब्रेस्ट को नीचे से पकड़ के थोड़ा सा उसके पास ले गई। तो वो
हम्म।
थोड़ा ऐसे से कुछ कुछ करेगा, या पीछे खींचेगा, या ओह 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 करके
हाँ हाँ,
रोना
यही
स्टार्ट
करता है।
करेगा। ठीक है, ऐसे ही करता होगा। अब क्या
जी।
करो, जैसे ये हो रहा है तुम उसकी बॉटल अपने यहाँ लेफ्ट साइड में रखोगी। ठीक है,
हाँ।
यही पोजीशन है तुम्हारी, तुमने बॉटल को यहाँ से लिया और धीरे से उसके मुंह में यहीं से लगा दिया। ठीक है,
हम्म।
अब वो अपना
ठीक।
पीना धीरे धीरे शुरू हो जाएंगे। बॉटल
हाँ।
जैसे ही पी रहे हैं ना, धीरे से बॉटल को ऐसे हटाओ, और फिर जैसे हल्का सा नींद में आने लगते ना बॉटल लेते लेते थोड़ा ऐसे ऐसे, तो
हम्म।
बॉटल हटा करके एक बार ब्रेस्ट पे फिर से लेने का ट्राई करो इसके अंदर।
हाँ
ठीक है,
हाँ।
ऐसा करो अंकिता इस हफ्ते, और फिर मुझे नेक्स्ट सैटरडे फ्राइडे पे बताओ इसके अंदर। ठीक है, बाकी
ठीक।
अलावा में डॉक्टर विनी से तुम्हारी कॉल चली रही है आजकल, उनके साथ भी
जी।
डिस्कस करो इस चीज को लेकर के। अगर कोई चीज ऐसी हो जो हमने जैसे आज ही डिस्कस किया है, इसके बारे में उनको बता देना, तो वो मुझसे भी डिस्कस कर लेगी इस चीज के ऊपर। ठीक है,
ठीक है मैम।
क्लियर।
ठीक है मैम।
चलो ट्राई
ठीक।
करो। बाकी मिल्क सप्लाई तो ठीक है ना, तुम्हारा फॉर्मूला तो अब कम हो रहा है।
हाँ मैम, फॉर्मूला कम हुआ है मिल्क सप्लाई पर, अभी ये सब ट्राई करने में इसको टाइम देती हूँ, तो फिर थोड़ा पंपिंग
हाँ,
शेड्यूल डिस्टर्ब हो जाता है।
करेक्ट करेक्ट,
तो
हाँ वो मैं समझ सकती हूँ, क्योंकि आप जब इसमें बहुत टाइम लगा देते हो, तो फिर पंप के लिए टाइम कम मिल पाता है।
हाँ
आई
हाँ
अंडरस्टैंड।
हाँ।
ठीक है,
तो
तो
हो
अभी इन
जाता है।
चीजों पे वर्क करो, लेकिन मिल्क सप्लाई भी मेंटेन रखनी है अंकिता। ठीक है, मैं
वो
समझ
मैम
सकती हूँ।
जितना है ना अभी उतना बना हुआ है, एकदम बहुत बढ़ भी नहीं रहा है लेकिन कम भी नहीं हो रहा है, तो
हाँ,
अभी
लेकिन
जितना आ
अगर
रहा था।
पंपिंग कम करोगी तो धीरे धीरे फिर वापस कम होने लगेगा ना, क्योंकि डिमांड नहीं जाएगी, तो फिर मिल्क सप्लाई ड्रॉप
नहीं,
करने
मैं
लगेगी।
कोशिश करती हूँ जैसे ही थोड़ा सा सेटल डाउन होता है फिर पंपिंग करती हूँ, तो पांच
ओके
से छह पंपिंग, 5 तो कम से कम कर लेती हूँ, ऐसा
ओके,
होता
तो
है।
तुम्हारा बेसिकली एक बात बताओ कि लैचिंग को लेके इतना ज्यादा लेकिन परेशान हो क्यों? पंपिंग की वजह से, कि पंपिंग कर नहीं पाऊंगी आगे इतना?
जी। मैं
मतलब
चाह रही हूँ कि ब्रेस्ट पे आ जाए, क्योंकि ब्रेस्ट मिल्क देना चाहती हूँ, लेकिन इतना
हाँ,
पंप करके हमेशा नहीं दे पाऊंगी, उतना टाइम नहीं कर पाती हूँ।
ठीक
तो
है ठीक है, तो इसके ऊपर वर्क करो इसके ऊपर। और कुछ चीजें मैं एक और बोलूंगी कि पंपिंग सेशंस अभी धीरे धीरे बाद में कम भी होंगे वैसे।
हाँ
जैसे तुम्हारे अगर 8 चल रहे होंगे तो 7 हो जाएंगे, 7 हो रहे होंगे तो 5 हो जाएंगे। धीरे धीरे पंपिंग सेशंस कम होते जाएंगे, क्योंकि इसको ऐसे समझो कि अगर हमारी बॉडी को पता है कि इतना मिल्क बनाना है, ठीक है,
हाँ हाँ
बाद में
हाँ
अगर हमारे सपोज वो 7 पंप्स में आ रहा है, तो हम जब
हाँ।
मेडिसिन विड्रॉ करना शुरू करते हैं, तो पंपिंग के टाइमिंग्स हम कम करते जाते हैं इसके
हम्म।
अंदर। तो
हम्म।
कई बार हम लोग 4 या 5 पंप मदर को छोड़ देते हैं कि अभी तुम्हारा मेंटेन इसी पे ही करो, 4 to 5
हम्म।
पंप्स पे।
अच्छा।
ठीक है, लेकिन अभी क्योंकि अगर तुम डायरेक्ट फीडिंग के लिए ज्यादा ट्राई कर रहे हो, तो उतने पंपिंग कर नहीं पा रहे होगे। तो मिल्क
हाँ।
सप्लाई को फिर हमको बढ़ाने के लिए अभी हमको दोनों जगह काम करना है। उसको भी मेंटेन रखने के लिए सब चीजें करनी पड़ेंगी, और डायरेक्ट फीडिंग के लिए भी। तो
हम्म।
इसलिए अब एक हफ्ता अच्छे से ट्राई कर लो अंकिता। अगर नहीं हो रहा है, डायरेक्ट फीडिंग पे कुछ नहीं हो रहा है, तो तुम फिर पंपिंग सेशन पे वर्क करो कि तुम्हारे पंपिंग सेशंस कम कर पाए इसके अंदर।
हाँ, वो कैसे
ठीक
होगा
है,
मैम? अभी तो
बताया
वैसे
ना
ही
मैंने। मैं बता रही हूँ ना, जैसे सपोज फॉर एग्जाम्पल, एक एग्जाम्पल देते हो, सपोज एक बच्चे को हमें चाहिए कि उसको 600 ml पर मंथ पर वीक हमें देना है, ठीक है।
हाँ।
अब जैसे जैसे हम आगे बढ़ते जाते हैं, मिल्क की सप्लाई बॉडी रेगुलेट करती जाती है। तो जैसे हमको सपोज 600 ml हमको आ रहा है जो कि हम बच्चे को दे रहे हैं, और ऊपर से हमें कोई फॉर्मुला मिल्क नहीं देना पड़ रहा है, और बच्चे का वेट गेन ठीक हो रहा है, और सपोज ये हम 7 पंप्स पे मेंटेन कर रहे हैं, तो अगले हफ्ते हम क्या बोलते हैं, मदर को बोलते हैं अब तुम 6 पंप्स कर दो, ठीक है। और
अच्छा।
हम कोशिश करते हैं कि सेम मिल्क को हम रेगुलेट करें, और बच्चे का वेट देखते रहते हैं। वेट अगर हमें ठीक मिल रहा है और कम पंपिंग सेशन में भी हम उतना मिल्क ले पा रहे हैं जो कि उसका वेट बढ़ा रहा है, तो फिर हम पंपिंग सेशंस को और एक कम कर देते हैं। इस तरह से हम पंपिंग सेशन, अभी जैसे मेरी एक हैदराबाद की मदर है, उसका हम लोगों ने 8 पंप से शुरू किया था, इस समय वो 4 पंप्स में है, जिसमें वो 2 दिन का मिल्क अपने पास स्टोर भी कर रही है इसके अंदर,
वाह।
ठीक है। तो इसलिए क्योंकि अभी हम डायरेक्ट फीडिंग पे भी फोकस कर रहे हैं, तो हम इधर रेगुलेट नहीं कर पा रहे हैं इन चीजों
हाँ
को,
हाँ
ठीक है अंकिता।
हाँ
ओके,
हाँ।
क्लियर।
ठीक है मैम। ठीक है।
ओके,
थैंक यू मैम।
वेलकम। ओके, सो नेक्स्ट क्वेश्चन इज Ravali. Ravali says, thank you, doctor. How can I reach out to the team? Is there any link to register or something? So, Ravali, you would be on the email list. So, just drop in an email and they'll give you the number of the team, and you can contact the team tomorrow morning. Next question is from Jayashri. My baby use only one breast for feed. He doesn't latch the second one. Okay, this is again very common, Jayashri. What you need to do in this? Now imagine if you are feeding the baby from the one breast and baby is comfortable, and now even you are comfortable from that side. If the baby starts crying, we try to put the baby on the same side where the baby is more comfortable. So what will happen? The baby will feed on one side, and obviously the milk supply will be maintained that side. The other side milk supply will go down. So 1 minute. Yeah. So now, what we need to do here, Jayashree, whenever you're trying for the baby to feed, when the baby's hungry and you're trying, first put the side where the baby is not coming. Try that side. Once the baby starts crying or rejecting, put the baby on the first side where the baby is comfortable. Once the baby has taken, suppose the baby feeds for 10 minutes or 5 minutes. So when the baby has taken some time, now just remove the baby and put again on the same side, other side. I know this shifting is not advisable, but this is for your case only, Jayashree. All the mothers who are listening here, this is not a general case. Here, the baby is not coming on the breast. That's why I'm giving her this protocols. So she has to put the baby on the other breast. And once again the baby starts reaving, then put the baby back to the breast. Disclaimer, this is not for everyone. This is only for Jayashree right now. So in this way, you are trying on every feeding session on the other breast also. Second thing is you have to check the milk supply on the other side. Usually what happens if the feeding is less on the other breast, the milk supply goes down. So if your milk supply is very less on that side, you need to regularly pump on that side to improve the milk supply first. Once the milk supply is good, then you start doing this movement here and there. Okay, good. So work on this, Jayashree. If this is not helping you at all, then reach out to the latch expert. Only if your breast milk supply is good. If your breast milk supply is not good on the side where the baby is not latching, then you first need to work on the milk supply. Next is from Ravali. If 45 minutes is shallow latching, then how can I fix my baby to latch properly? Please help me in that. So now let me tell you. Suppose 45 minutes. Why do I say 45 minutes is shallow latching? It's about the gulping, Ravali. If you see your baby doing gulping, and today you just watch your baby. Once your baby starts latching, you will see the suckling. Like suppose there is water in the glass and you have to drink this water. Then to take the water down your throat, you need to do like this, na? Correct? So the same way when the baby is latching, baby needs to suckle inside. If the baby is not suckling, that means the baby is not drinking milk. Mouth movement is not important. This chin movement is not important. The most important thing is gulping. So if you are seeing this gulping for few 10 minutes, 5 minutes, that means your baby is drinking. But if after 15 minutes you are not seeing the gulping movement, baby is just like on the breast, giving pause and just moving this, but not gulping here. That means your baby is doing shallow latching or passive feeding. You need to work on this, Ravali, that the baby should be doing an active feeding. If the baby is not doing active feeding, even after you have tried to wake up the child, and then you remove the baby from the breast. There is no use of sitting there with the baby for 45 minutes and still giving formula milk after that. So you need to work on active feeding alone instead of longer feeding sessions. I hope it is clear now, Ravali. So that's all for today. There are no more questions here. Good to see. It was a good discussion today. I like the way we discussed today a lot of things about latching and about the concerns. So that's all for today, girls. I hope everything, we don't have any new questions. So take care, everyone. Have a very good weekend and a very good night to all of you. I know you all would be waking up with your babies. So this is a phase I have been through, but now I get relaxed, good night's sleep. And don't worry, you will also have that. So it is just a matter of few more months. Thank you for these hearts on my screen. Thank you so much, girls, and all the best. And take care, everyone. And please take care of your health. Today, my mother was telling me in the afternoon that, ma'am, I don't get time to eat lunch also. So this is not good for your health. You need to take care of your health. If you don't have a strong health and a strong body, then how you will take care of your child and your family? You need to take care of yours. And today on International Women's Day, make sure that you take good care of your body and your health also. Make it your priority also. Okay? All the best, girls.